For the scars in particular, the sort of the program that's kind of advanced the most is the one from the company Biohaven using the drug troriluzole. So that's sort of something that's currently being evaluated by the regulators and something that they're hoping will address a number of scars. Then there is the drug riluzole itself, which is the sort of troriluzole, the prodrug of riluzole. So that's another sort of drug that's been investigated. And then there's a number of sort of groups looking at antisense oligonucleotides or gene therapy kind of approaches, which of course are quite different from what we're talking about here with sort of molecules. And then in terms of other kind of treatments, there's cerebellar transcranial stimulation as a sort of symptom relief kind of treatment, and obviously there's also physiotherapy type interventions that are being explored and that kind of thing. In terms of things that are more at the preclinical stage, there's a number of sort of drug repurposing kind of projects that are looking at different approaches and different drugs, but essentially in the sort of clinical trial stage, these are the ones that I've mentioned are the ones that are most advanced in the scars, in the spinocerebellar ataxias.
Yeah, and to add to that, Julie, you mentioned troriluzole, which is now in phase 3, Biohaven, which has a history on riluzole, which has been approved in the US at least for ALS. And the interesting thing about riluzole and troriluzole is that before long, nobody really knew exactly how it worked, also not in ALS, but it hits also the SK2 channel. So that's promising. So we're seeing a company that takes troriluzole to phase 3. They must have seen positive signals, of course, in their phase 2. And the fact that, and that's for us is promising, as I was saying in the beginning, we're looking for really high affinity molecules that modulate the SK2 channel. So here we might already have some positive data in the future when it is approved. And then, of course, what we are after is an optimized molecule that hopefully is even more efficacious than troriluzole. So it is very promising direction it's going. It is very good for the patient community that there is a solution ahead.